All right, welcome everyone. So excited to have all of you here with us today for the fourth installment in our series of training on the radar coverage tool with our colleagues from Johns Hopkins University. My name is Jessica Ferne. My pronouns are she and her, and I am the Director of Global Health Impact here at CanWaCH. So I would like to welcome all of you, those that are joining us for the first time for this fourth of 4 sessions, and to those of you who I know have been with us for several or all of the previous sessions as well. A few quick words before we dive in. So if you've been in the session before, you know we're very pleased to be able to offer simultaneous translation in English and French. You have a couple of options. These were sent in the email to you, either to go to interpret.world and enter the token radar coverage, or to download the app to your smartphone and connect that way, again, using the same token. If you're having any difficulty connecting with translation throughout the session, please let us know in the chat and we will be sure to help you out with that. Today's session is going to be talking specifically about survey sampling and how that works within the context of the radar coverage tool. As we go forward, you can get some technical support if you require it at any time from my wonderful colleague, Tina La Rochelle. She's listed as Tina La Rochelle Tech Support in the chat. You can write to her directly and she can help you out with anything that you need. These sessions will be recorded. After now all 4 of them have been completed, we're going to take a little bit of time to edit them down to make them short and useful, and then we'll be working with our friends from JHU to make these available to you, and so that you can refer back to them or share them with your team. That means that sometimes your name might pop up, particularly if you're speaking, which we encourage you to do, particularly in this section, as it is quite interactive. So if you'd like to control how your name appears or to just replace it with the name of your organization and you're not quite sure how to do that, you can go to the image around, or the square around your face, top right corner. There's a 3 dots or an ellipses. Click on that and you have the option to rename yourself, or of course ask Tina and she'd be happy to help you. In the email before this session, I did send around a short Word document with a kind of pre-assignment that our friends will tell you a little bit more about, and we'll be sharing that momentarily in the chat in case you don't have it handy with you. As well, in the email, there is a link to this website, which we encourage you to have open because there will be references to it, and we'll again post some more information in the chat. So with that, I will turn it over to Talata from Johns Hopkins to take it from here. Talata, over to you.
Thanks so much, Jessica. So my name is Tarata. For those of you who have been attending all of these, you're probably already familiar with most of our team here. But I wanted to do a brief introduction. So I'm a research associate. I work on the radar project on a number of tools, including the coverage survey tool. And the 2 speakers today will be Melinda Munos and Abdoulaye Maiga, both of whom have spoken previously, but maybe if you want to reintroduce yourselves, maybe Melinda first, then Maiga.
Sure, thanks, Talata. Hi, everyone. If you've been on one of these calls previously, you've heard from me already, but my name is Melinda Munos. I'm an assistant professor at the School of Public Health at Johns Hopkins, focusing on program evaluation and measurement, and I'm the lead for this coverage tool on the radar project. Maiga, over to you.
Okay, thank you, Melinda. Thank you, Talata. Hi, everyone. I'm Abdoulaye Maiga. I'm an assistant scientist at the School of Public Health at Johns Hopkins University. I'm also part of the radar coverage tool and also working mainly on evaluation, server implementation, coverage, and health system. So nice to be with you today.
Excellent. So I think we can go ahead and start with the presentation.
So I just wanted to introduce the objectives of this webinar and talk a little bit about the project very briefly for anybody on the phone who hasn't been on one of the previous webinars. So what we want to do today is to present the tools that we've been developing for sample size calculation and for cluster and household sampling, both of which are issues that when we've talked with partners and when we've worked with partners have sort of come up as some of the major areas where people would like technical assistance or that they found challenging. And we would also like to get your feedback on those tools. So we're first going to, as we are right now, talk about the objectives and the agenda. And then Maiga is going to spend some time going into some detail on sample size calculation and present, walk you through the Radar sample size calculator, which there's a link to it on the website so you can follow along. We'll have some time for questions and discussion. Then I will talk a bit about the Radar tools for sampling. We'll have questions and discussion on those. And then we have some time for you to actually play with the sample size calculator in groups. So you should have received an email asking you to sort of, with the activity for today, asking you to think about, you know, a survey that you're doing or that you're planning to do, and some indicators that that you would like to calculate the sample size for. So we'll work through that in groups together, and then we'll have some time at the end in plenary for discussion and to close. Okay, so I'm just going to say a few words about the Radar project. I think most people here have been on one of the previous webinars, so apologies if this is repetitive, but for anybody who has not been on or who has forgotten, the aim of the Radar project is to support project design, monitoring, and evaluation with the ultimate goal of improving accountability. And the way in which we're doing this is by developing tools to improve country level accountability. So basically to make it easier to evaluate programs, specifically for MNCH and nutrition and sexual and reproductive health. And there are a number of tools, of which this coverage tool is one. We also want to build a cadre of tool experts in Canada and elsewhere, improve the usability of the tools, and make the full set of tools and supporting materials available on the website or elsewhere. And again, as we have been working on the coverage tool and working with partners and piloting the tool, we've noted that for many partners, planning and implementation were real challenges. So the challenge wasn't necessarily just getting a questionnaire, but actually getting the tools and the resources to be able to implement that well. So these sample size calculation and sampling tools are part of our attempt to sort of address some of those barriers. So as I mentioned, there are a number of Radar tools that all try to sort of answer different questions that you might want to answer when you are evaluating a program. The one that we're focusing on today is question 4. Do women, men, and children who need interventions actually receive them? So this is our coverage survey tool to measure intervention coverage, which we define as the proportion of individuals in need of a service or intervention who actually receive it. So we, again, tried to sort of map out what all of the tasks are to plan and execute a survey and develop tools around those. So today we're focusing on tools to determine your sample size and then to sample clusters and households. So that is a sample size calculator, indicator sheets, which we've talked about previously, we're not going to go back over today, but also mapping materials and sampling tools. And some of these are on the website. The sample size calculator is on the website. The Excel-based sampling tools are also on the website. and the sort of desktop app for the sampling will be available hopefully later this month. We're just, the developer is continuing to work on it. And with that, I will hand it over to Maiga to talk about sample size calculation. Let me stop sharing here. Maiga, can you share your screen?
Oh, it looks like you are still sharing. Okay. Oh. No.
No.
Yeah.
Do you want me to put it back up?
Mm.
We can try troubleshooting that over here. Maiga, I know it worked before in the practice, so maybe we just need to adjust some things. But Melinda, if you want to go ahead and share your screen, we can work on that over here.
Sure. So Maiga, do you want to go ahead with the sample size calculation? And
Yeah.
I'll just advance the slides.
Oh, okay. You are still sharing.
Yeah, I put it back up.
Okay, let me see. Okay, so I'm going to stop. Wait. Okay. Okay, thank you, Melinda. So I'm going to take you through the sample size of calculator. But before talking about the sample size calculator, we are going to go through a few concepts that are related to sample size calculations, and also to how to better calculate the sample size. So sample size calculations for people who are familiar with that, it's a crucial step for the success of your study. But it's also a very complex process that we need to take care to ensure that we are going to properly calculate the sample size we need for our study. So appropriate sample size, it's a critical conditions, okay, to be able to detect the difference or the change you want to measure, and also to get confidence in your estimates. A good sample size combined to a good sampling will also help to provide an accurate picture of your populations. That means that a too small sample size may be a waste of time, effort, money, because you are going to end up with unusual result. On the other hand, a large sample size may also be a wasteful for resources as well, and expose more participants more than need, because you are going to interview more people that you actually need for your study. But let's go through now the cyber process to know that what we need, okay, to do. Melinda, please, next. Okay. The server design process start with defining the objective of your server that will be used to draw the list of indicators needed for your evaluation. And based now on this list of indicators, you have now to figure out about the appropriate sampling design and also how to calculate the required sample size, and also how to draft the questionnaire you needed for your data collections. So throughout of this process, it's very important to take into consideration the resources needed to implement your server. So staffing, funding, and timing are key elements that should be included in the resources. So depending now on resources available, you may need to calculate the sample size, revisit the list of indicators, or revise your server objective. Next, please. Also, as a considerations regarding the indicators selections, we should aware that the indicator selection profoundly affect your sample size. Because of different indicators, for different indicators, we may need a different sample size depending on who we are including as a target population. And also, we recommend to calculate the sample size for all the indicators, and then now to determine the sample size based on your minimum sample size for the indicators for which we require the largest sample size. And also, typically, there are some indicators that need a larger sample size. For instance, adolescents age 15 to 19, or for instance, children age less than 6 months. Next. Okay, this is also something very important in terms of how to process the calculation of the sample size. Sample size calculation need to take into account the sampling design of the study and also the analyzing plan. Then one question to be maybe to try to see if you are going to include the stratifications, or your study, in your design, you are going to include multi-level units for your sampling. Another question, what you need to try to answer when you proceed to calculate of a sample size is to try to see what is the purpose of your analysis. And in terms of objective, you may be interested on just a point estimate. You may also be interested in comparison among several groups, or trying to track change over time, or also trying to compare different groups with different sample size. And depending now of the different purpose, you may also have to adjust your sample size accordingly. And there are two options we are going to see in the next slide. That is to know that whether you should care about the precision-based or the power-based sample size calculations, but usually we recommend to carry out both. Next. The resources, it's a key and crucial aspect to take into consideration. Okay, you may end up with a sample size, a given sample size, but you will need to figure out whether we have enough resources to cover the sample size. And in terms of resources, the resources are comprised of the personnel, what you need, the equipment, the supply, because for some different sample size, you may need more staff, you may need some specific personnel or some specific equipment, like indicators related to anthropometry, or also indicator related to HIV biomarker that need special or specific personnel or equipment. And one advice is also to try to include as far as possible someone who has experience in sample size calculations to try to ease the process of sample size calculations. That can be a biostatistician, a demographer, or a statistician. Let's see now how to calculate the sample size. So the different options. Next, please. The first option for sample size calculation is the precision-based sample size calculations. This is an approach that is based on what we call the margin of error or desired precision to have in the sample point estimator. So any estimator based on that option will have some uncertainty around it and will depend to the sample size and also the underlying variability of the data. And the larger the sample size, the lower the uncertainty and also the better the precision. So big sample size, okay, also better precision and lower uncertainty. Next. 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 Okay, so this is basically the formula used for the sample size calculations based on the precisions. Okay, this is a common formula, so I'm not going to spend time, but there are some input we needed to care about, and we are going to talk about them later: the design effect, the estimate proportion, the desired precision, and also the response rate that are critical input that we need for the sample size calculations. And also concerning the estimate proportions, sometimes to try to obtain a conservative estimate with a bigger sample size, we often use 50% as estimator proportions. As precision-based sample calculations, it's mainly influenced by the target population, the desired precision, and also the estimate frequency and the design effect. Next. Power-based options for sample size calculations. It's an approach that only apply when we are comparing estimator for two populations, okay, to try to see the difference, for instance, between intervention and comparison area, or when we are trying to track change over time, for instance, what we change from the baseline to the end line. So this is an approach that is based on difference or change we want to detect. For instance, what will be the difference between the end line and between the end line, the baseline and the end line, or what can be also the difference we want to detect between two populations group. So the sample size and the design effect are both the major factor affecting the study power based on power-based sample size calculation. And also the larger the sample size based on the power-based, okay, a large sample size also provides a greater power to detect the change or the difference. The formula is quite a bit different from the precision-based, but there are some common input. So these are the design effect, the survey response rate, and also we also need to get the estimate proportions at the baseline and also the estimate proportion at the end line, or the proportions in each of the group we want to compare. So let's see now what are the different input we needed for sample size calculation and where we can try to obtain those different input. Let's begin first to provide some basic definitions. So the estimate frequency is what we expect, okay, to be the baseline, okay, level of the indicator, so for instance. And the margin of error or desired precision is basically the difference between the value in our sample, okay, and the value in the population, so meaning that half of the wide of the confidence interval. So the closer to zero, the margin of error, the larger the required sample size, and also the better the precision we are going to calculate. Difference to detect, this is for power-based options. This is the minimum difference from a baseline to end line, or the difference between two different groups, for instance, program area and comparison area, that we want to be able to detect. And so the closer to zero, the larger the required sample size, and also the better the estimate and the confident in our estimate. The non-response rate, it's the proportion of sampled household that we are not be able to interview for different reasons, for instance, related to refusal, the household we weren't able to find, interview postponed, or there were no competent respondents at the household. So these are used to try to see what are the response rate. And for the estimate frequency and non-response rate, we are able to obtain those estimated from previous server. And this is something we are going to talk about later. Okay, so one of the sources to try to get the input is to try to refer to previous server and try to obtain those estimates. But it's also possible to make some assumptions based on our knowledge of the setting where we are implementing the study based on previous experience. Next. Next, please. The design effect, it's a correction factor, okay? We use to adjust the sample size in order to reflect the sampling method, okay? This is something that commonly used for cluster sampling or stratifier sampling. And different sampling method may also require larger or smaller sample size that you will need if we were using sample random sampling. We are talking about sample random sampling because the design effect, basically when we try to calculate it, it's just the division of the variance from our complex complex sampling compared to the simple random sampling. And since and also typically cluster sampling will require a larger sample size compared to the simple random sampling. So the design effect will vary, okay, depending on first the indicators and also the stratum and the server. Yeah, typically we will not be able to know our exact design effect before the server, but we can at least try to estimate it from over server with similar sampling design and similar indicators measurement, and also in similar population. There is a way for using some design effect or over input from over server, but there are also some requirements we need to try to meet. That means that similar sampling design, similar indicator measurement, and also similar populations to be able to use them for our study. But in the event of absence of over information to try to define our design effect, a design effect of 2 is a good role of trop for cluster sampling. But this is something so we should try to use as a final option, because it's always preferable to use the design effect from previous study, meeting the requirement we talk about. Next. Demographic and health server program, or the multiple indicator cluster server mix, or DHS, are some good sources to try to get some input we need to use of our sample size calculations. So you can see that in the appendix of the appendix B of any DHS report, you should be able to see where in table B2, for instance, in Tanzania, where to obtain some information related to the design effect that can be used for our sample size calculations. But very frequently, the indicator that you want may not be in the table, but you can use a similar indicator or use the average from a similar indicator. And also, you can compute your design effect using the raw data set to try to get it for your indicator and also for the specific area you are interested. And it's also recommended and better to use the design effect for data whether available for sub-national unit for an evaluation you want to carry out at sub-national level. For instance, if I'm interested to do my study in region B, if there are some previous survey when I'm able to get the input and particularly design effect of region B, it would be better than using the design effect calculator nationwide. There are also additional input from this table and also from other table in DHS mix report. So we are also able to get from this table and other table the unweighted number of target populations to use as a denominator for a given indicator. So for each indicator, so for instance, if I pick just populations using Munos contraception, I will be able to get also the unweight. We recommend to use the unweighted number for this exercise, but not the weighted. And also, we are also able to get some proportion, some frequencies that are also required to calculate our sample size. For instance, you can see that proportions currently using a Munos contraception, it's about 32% in Tanzania, okay, nationally. So this is also some sources of data. We have also similar table in a mixed report that can also be used to extract, compile input that will be used for our sample size calculation. Next. Okay, once we calculate the required number of individuals for our different indicators, so there's a need now to convert now those individual into household. because household will be the level of sampling, the latest level of sampling we are going to use to make our data collections. So we need for this purpose to calculate a household conversion factor. So this is the average number of individuals in the denominators. For instance, the number of women with a live birth in the last 2 years per household. And also this conversion factor may vary by indicators and by setting. Okay, you can also estimate this conversion factor using previous data, whether data available, and also whether the different requirements we talked about previously are also met. So we need two components to estimate the conversion factor. That are the number of individuals in the denominator divided by the number of households that have been interviewed. Next. So this is just a figure trying to show that how we should go from target population to the number of households. So if for instance, our indicator is relating to adolescents, once we obtain the required number of adolescents, we need now to see now how many households we need to interview to try to get the required number of adolescents. Or if our target population is also the women of reproductive age, we also need first to calculate the required number of women of reproductive age, and then now to see how many households we need at the end of the day to interview to obtain or to reach the required number of individuals that have been calculated. To also get the conversion factor, there are also some data that can be used from a previous server. Next. Here it's the number of interview household that is also available in DHS report. So here it's for instance in Tanzania, okay, we are able to see that for the different area of residence and also nationwide, what was the number of people that have been, the number of households that have been interviewed. And we are also able to get those information from additional table that are in the report, or also trying to get these information from the raw data set if we are familiar on how to manage and make the calculations. So once we have the number of interview households, we should also try to see how to get also the number of individuals in the denominator. This is also an information that is available in the report. Next. Next. Yeah. Please, go back, please. Go back, please. Yeah, so here is where it is also a table in the report where we are able to get some data related to the number of individuals that are being interviewed. I don't know what's happening, but there is a total at the bottom of the table. Okay, so you should be able to see how many people in total have been interviewed. Okay, this is for instance, if we are interested on getting the number of children under age 5 with a symptom of suspected pneumonia, for instance, we can get this information, and it's from here that will be used as a denominator or target population, for instance, for an indicators related to care seeking for suspect pneumonia or treatment of symptoms of acute respiratory infections. So these are some source of data, okay, we can use to try to get the information related to the household conversion factor. So these are some basic sources of data. You can get them from the report, or we can also try to get them making our own calculations based on the raw data set. The next is a sample size calculator. I was wondering whether we should not try to, okay, thank you, Melinda, okay. So this is the welcome page of the radar sample size calculation. We develop an Excel base and a web-based application to calculate the sample size required for your evaluation of your study. Since the Excel base is not very straightforward for people who are not very familiar with sample size calculation, so we also develop this web-based application that is a user-friendly interface that people can use based on step-by-step approach, okay, to correctly plan and calculate your sample size. There are some existing sample size calculator on the web, but they are not appropriate for sample size calculation for household server, as they do not account sometimes for the complex server design, or do not account for the non-response rate, or sometimes do not account for the conversions from individual to household, and they may also sometimes underestimate your sample size. This tool allows us to calculate the required number of target individual, as well as the required number of household to achieve the desired precision or the power for our study. And also, we are able to calculate the expected precision or the magnitude of change of difference that we can be able to detect given a particular sample size. So I was wondering whether we should not maybe try to answer a few questions and then go through walk through the radar sample size calculator. I don't know what's happening.
Yeah, there are quite a few questions in the chat box. Really good questions, actually. So thank you, Tamrat. I think we could address those now, because those are sort of around, you know, why do we do certain things in sample size calculation, or why do we approach it in a certain way? So perhaps we take those, and any other questions on sort of the theory before we get into the sample size calculator.
Yeah, and I also hope that I will be able to use it from my computer, okay, yeah, to work through, yeah.
Let me stop sharing.
Can you stop?
So Maiga, why don't you work on see if you can get your screen shared, and while you do that, I'll start with some of the questions.
Okay,
Does that work?
Okay, yeah, so I will try to fix it.
Okay. So I'm just going through the questions in the chat box. I think the first one was, Tamarat said, from a pragmatic point of view, we don't necessarily aim to power all of our indicators because just one indicator may cause a huge cost increase by inflating the sample size, such as exclusive breastfeeding. We would have to let some indicators go with poor power because of cost implications. What is others' experience? So I will say from our experience, yes, this is true. There are certain indicators that have much larger sample size requirements. And so there may be some where you decide, I'm just going to have very poor precision or very poor power on this indicator, and it's okay because it's not one of our core indicators. The sort of caveat to that is you want to be then conscious of that when you're reporting out on that indicator, right? So if it's you know, exclusive breastfeeding where you have, let's say, your precision is 20 percentage points, which means your confidence interval will be 40 percentage points wide. You're going to have very little confidence in what you're reporting out for the exclusive breastfeeding rate. So you wouldn't want to rely on that to draw, you know, conclusions about your program, or necessarily, you know, say, oh, this group is breastfeeding more than this group. And it may be that you decide not to include certain indicators if you your sample size is not going to be remotely big enough to get a precise estimate. But what you're saying is certainly an issue, that we do encourage people to calculate out the sample size for all of their indicators so that you sort of have an understanding of which ones you will be better powered for and which ones you will have sort of less certainty or confidence. But it's usually the case that there will be a couple that just, you know, you're not going to be able to measure very precisely, and you have to live with that. And I think the next question was, is the precision estimator used for evaluation of interventions or DHS type of surveys only? And then with the follow-up, your choice will, you don't use both formulas at the same time. Your choice will be the formula that calculates your sample size used for comparing 2 points. And when is the precision formula relevant? So the precision, I tend to think precision is always relevant, and whenever I'm doing a household survey, I will calculate it. And then I will also usually calculate power, assuming we're doing any kind of comparison or time trend. So precision is relevant sort of anytime you want to report out on an indicator. And sorry, I just realized I have my video off, so let me turn that on so you can see me. Precision is relevant anytime you want to report out on an indicator from your survey. So if you want to say, you know, our exclusive breastfeeding in this region is, you know, 20 percentage points or whatnot, and you then want to use that to inform your programming, to target certain populations, or for whatever reason, that's where precision is relevant, because you want to know sort of how certain are you that it is actually 20 percentage points. Is it 20 percentage points plus or minus 5? Is it 20% plus or minus 5 percentage points, or is it 20% plus or minus, you know, 20 percentage points? And there's a huge difference between those. You're right that if your primary goal is to look at change over time, then you might put more weight on the power calculation than the precision calculation. So you might live with sort of worse precision as long as the power is decent. But I think it's always good to be sort of aware of what the level of precision is, so that you can keep that in mind when you're reporting out. And then one question about the going from a target group to a household. So this is a question I think we get a lot, and it's an important question. So why, if you're mostly interested in women with a live birth in the last 2 years, say for maternal indicators, or children less than 2 years for a number of the child indicators, then why can't you just sample those? Rather than having to go to lots of households to identify those. And so the question that I have then is, how do you identify those women with a live birth in the last 2 years, or women with a child under 2? the way we usually do it in a household survey is when we go in, we do a roster, a listing of everyone who lives in the household, and that's used to identify sort of people who are eligible for individual interviews. So say women of reproductive age, and those women will then get asked, questions around, when was what was the date of your last live birth, or we identify kids, within a certain age band. So certainly, if you go to a household and there's no one in, let's say there's no children under 2, and you're interested only in children under 2, then you move on to the next household. But there's not a great way to get that I know of to get around that. I think sometimes if programs are working in areas where you are trying to identify beneficiaries, right? Or you think you have a list of beneficiaries. I think sometimes the idea is, well, we'll sample from that list, which if you are confident that your list is sort of comprehensive in your cluster, right? That you've identified all children under 2, they're all on that list, it's up to date. And that may be an acceptable way to do it. But I think oftentimes you're doing these surveys because you're not sure you've identified everyone. And so the goal of the survey is really to look at the population as a whole, make sure that you're identifying everybody in need in the population, including those who may not be served by the program, right? Who may not have been identified by the program, and then look at what they're receiving in terms of interventions. So this is why we talk about household conversion factor, because DHS does it, obviously. Anyone who's not doing a program does it this way because we have no way of knowing who's in what target group in the cluster. But even as a program, particularly when you're coming in at the beginning, you also may not know who's in a particular target group. So there's a follow-up question. Skipping the households that don't fulfill the requirement is another. Is that problematic? So I think as long as you are, the question is, how do you determine which households are fulfilling the requirement? So which households have individuals in your target group? We recommend against screening questions, which were for a long time actually, were used, for example, by EPI for their surveys. Is there a child under 5 in this household? And I think SMART still uses them, or at least some countries doing SMART surveys still use them. The problem with screening questions like that is that you're only asking one person in the household, and so vulnerable household members tend to get left out, right? They may not mention, or they may forget to mention, the houseboy or housegirl, or whatever household help they have there. They might forget their sister-in-law's, new baby. So it can be tricky to identify everybody who kind of falls within that group that you're interested in. And again, the people who tend to get missed are the more vulnerable ones who the respondent may not consider fully a member of the household, or may just forget about. So early on, actually, when we were developing this tool and we were really trying to make it light, we brought together a number of folks who've worked on different types of household surveys for many more years than I have, actually. And this was one of the questions we asked. We said, is there any way that we can get rid of the household listing, because it's extremely time consuming, right? It's heavy. And we kind of looked at it from different angles and came to the conclusion that no, that if you want to have something that really represents the population, you need to keep that listing. Okay, so I think that's the questions in the chat box. Maiga, how are we doing on the screen share?
Yeah, I restarted. So looks like now it should work. I hope. Yeah, it should work.
Okay, so maybe we'll do, I realized we didn't, I answered the questions in the chat box, but folks may have others. Why don't should we go through the sample size calculator and come back and see if there's more questions after that?
Yeah, I agree. Okay. This is great, yeah. So since maybe some of the answer will be fixed, or the question will be answered during the presentation of the sample size, calculator. So thank you, Melinda, for presenting was different. So now I'm going to show the sample size calculator. So I don't know if everybody is able to see what I'm, Melinda?
Yes, we can.
Yep, I can see it.
You can see the sample size calculator?
Yes.
Okay, good. So this is how the sample size calculator look on the website. And we also provide the links on how to access to this sample size. It's just a radar or sample size calculator.org. And once you access to this web page, you have the options to calculate your sample size based on the precision or the power-based options. So as we said, the precision-based options allow to calculate the required number of households based on some on a allowable error in the sample point estimator. Or also, you can also calculate the related level of precision for a desired number of households. Okay, you can talk later about that if you're interested. Now, the second option, power-based, allow us to calculate the required number of households based on a minimum difference between two groups you want to compare. For instance, comparison and intervention area, or if you're interested to track the change over time using two time pointer. Okay, and also we are also able to use this tool to calculate the detectable difference or the minimum change for a desired number of households. So let's pick the first, the precision based second one. Once we open our so me, I want to be sure that I don't have any questions coming. Okay, good. So once we open our page, there is about that provide information relating to the tool. And also we add the language, so we are able to use either French or English if you want for this. And also, if there are some comment or some feedback or some questions, there is also a way to do that. Once we open it, here it's where we have our different indicators that are being put together by type of care. According to the continuum of care. So we have family planning, we have all the indicators of family planning, okay? And also we had a letter also antenatal care, delivery, postnatal care, children health, children curative health, nutrition impact, vector control, water, and sanitation. And for all of those categories of indicators, so we have non-specific indicator. So now, after that, we have here where we can also try to provide the different parameters and to select our indicators. So let's try to go through one example. Maybe we're interested to calculate a sample size where we are interested in MCPR, modern potential prevalence rate. Okay, we have just to pick it. And we can also pick an additional indicator also. But if there is an indicator also that is not, you are interested to calculate the sample size for an indicator that is not in this list, you are also able to provide and also to customize your own indicators. So it's just to come to manage the indicators and then add one indicator. You can say, okay, this is for instance my indicator, my custom indicator. Okay, I just need to add my custom indicators and then I apply. I can remove it if I'm interested. Once I have now both indicators I selected for my study. You can also see down here where we are able to see the custom indicator. Yeah. So once I select my indicators, the next step now is just to move now and provide now the different parameters. I have to do one by one. The first one is the body contraceptive rate. I can say that, okay, I'm interested to do that for women age from 15 to 49. Okay, okay, just select it. I'm good. And also, I just need to get down the input. We're talking how to get the different input for your indicators. For instance, it's a dummy data I'm going to use for this exercise. I can say that it was a study that had been conducted in 1,000 households, and there was about, let's say, 9. This was the number of women that have been of age of 15 to 49 in union or sexually active. And then I also need to provide information related to the number of households from which we got this number of women. Maybe let's say it was 986, okay? And then now we also need to provide also the household response rate in proportion here, okay? Let's say maybe it's also something like, yeah. So I'm done for the parameters for the first indicator. So once I'm done, here it's going to change to be now green, okay? And then I have to select now the second one. Second indicators is still red, okay? For this one, since it is a custom indicators, it's asking me if I want to choose a default target population from a drop down list. I can say that, okay, yes, I have to. I can select here the denominators of the target populations. But if it is not in the list, I can also say, okay, I want to customize the target population, and I can do that here. Okay, put whatever I want. Okay, as the denominators. But let's say that it's something existing in our default list. So we come in our default list. We say, okay, maybe it's a woman, let's say, who had a live birth in the last, ZZ days. Once I'm done, I have also to fill out everything relating to this indicator. So the age, let's say maybe it's adolescent, okay, maybe adolescent, okay, so it's 15 to 19. I have also to provide information related to the last years. And for this one, I'm going to select the 2 years. So now I have now my denominator that is custom. Number of women aged 15 to 49 years will be live birth in the last 2 years. And based on the same information I got from the DHS or mixed over sources, maybe it was, let's say, 250. And also here it's the same, okay? It should be the same here, okay? Yeah, so I'm done now with both indicators. So now it's green. I can move now to the next step to now provide the information relating to the parameters. And here, maybe I'm interested to compare a study of a baseline and endline. Okay, so let's say, for instance, as a baseline for the MCPR, it was 80%, but I want now to move and my endline to have something of, let's say, 25%. And with the effect that I was able to get was, let's say, maybe 2.1, okay? And then I have now to move now to my second indicators, also to do the same exercise. For my custom indicators, maybe it was something of proportion baseline 65, okay, 65%. And I'm targeting 75 at the end of my end line, and with that effect maybe was 2, okay? So I'm done now. We also provide the parameter. I have to move now to the next one. Once I'm done now, it's going to provide me now, okay, the required number of women age 15 to 14 in union. This is the number here. And also it's going to provide me the number of households I have to interview okay, to be able to detect the minimum difference of 7 percent. Okay, so that means that this is the minimum difference I'm able to detect with this sample size. I'm not able to detect a difference below that, but from 7%, I'm able to detect this difference based on this sample size. And for my adolescent women who have a last birth in the last 2 years, I need about 2,592 households to try to detect a minimum difference of 10% between the baseline and the end line. And I'm able to download this table for any purpose. And if I'm interested, maybe I don't have enough resources to try to get this, to try to cover these samples, I can come back and see also that what can be also other alternative options by changing some of the parameters to see that what I can be able to get. So this is the number of population. But I was also able to do the same, but now to see what can be the minimum difference I'm able to detect for a given sample size. Let's say, for instance, I'm interested on a household where I want to cover, let's say, 2,000, a server, 2,000 household. Okay, so 2,000. I want to see what is the minimum difference or change I'm able to detect for a server where I expect to interview 2,000 households. Once I'm done, now I also go there, and it's going to provide me the detectable difference. Okay, the minimum detectable, the minimum percentage I'm able to detect between my end line and my baseline for 2,000 households. So this is what the tool allows us to do. But we can also do the same, okay, for the precision base. Okay, to do the same exercise we have to do is just to provide the same information and move. Maybe here, if I'm interested to get the precision, the number of households, okay, let's say maybe here I'm going to be to use the conservative options for 50%, and desired precision, let's say maybe 5%. I'm interested. Design effect, let's say maybe 2. Okay, and here I also want to be 50%. Okay, maybe desire maybe the 5 also desire precision, and let's say maybe the same design effect. I also interested to get. Once I move, okay, this is what I should cover for as a sample size, number of household for this MCPR. But for the adolescents, where I have a target population that is smaller, I have to cover up to 3,000 households to try to get the same differences. But if I'm not able, I can come back and say, okay, maybe adolescents, instead of trying to target 5%, I'm going to maybe target 10% and see what's that will require in terms of. So if 10% now I'm able now to get a precision of 10%, that is not great. It's not great, but this is what I'm able to get as a precision for a server where my resources allow me just to cover maybe 8,000 households. So these are some different things people are able to do using the tool. So I will stop here. There are a lot of people will be able to discover. We already share the link with everybody. So I mean that some people already started playing with the tool. And also during the breakout room, okay, we are going also to continue this exercise. So let's continue with a few questions related to that. and also to the previous question, so before moving to the next. Thank you.
So are there any questions about either the tool or anything that we've talked about sample size estimation?
I just see some comment. Thank you very much. That is a great point. This is beautiful. Thank you.
I think you explained it very well, Maiga.
Thank you. Yeah. So if there is no more question, no more comment, I mean that maybe we can continue with the sampling. Melinda?
Okay, yes, I am just gonna get my PowerPoint back up. Can everyone see that?
Yes.
Yeah, maybe I can jump in right here and just remind Melinda, Maiga, whenever you want the poll to pop up, just give a heads up.
Okay.
Okay.
Right. Thank you.
Okay. Okay, so I'm going to go talk quickly about sampling. As I mentioned, the sampling tools aren't quite as advanced as the sample size calculator tools. And also we just didn't have time to talk about both in depth on this webinar. But I want to talk a little bit about sort of how we sample and why we sample the way we do and some of the tools, as well as some research we've been doing to try and come up with lighter ways of sampling. So I'm starting with this circle of inference that comes from a biostatistician, I think, at our school. But just a reminder that the idea of doing these surveys is to estimate what the truth is in our populations, and the way in which we sample has really important implications for how well we are able to see essentially what is happening in the population and how biased or unbiased our estimates are. With that said, I want to talk a bit about probability sampling, which is how we sample for household surveys and other types of surveys. It's the gold standard approach. And essentially what it means is that every household in the survey population has a known non-zero probability of being sampled. So that means everybody in the population has a chance of being sampled, and that we can calculate the probability of selection for any given household in the population. So I'm not going to go into a lot of detail as to why that is, but just note that is having a probability sample allows us to have a sample that represents the population, that reduces selection bias. It allows us to appropriately calculate the uncertainty around estimates. So that means estimating sort of what your standard error and your confidence intervals are. So how certain when you say that exclusive breastfeeding is 20%, how certain are we that it is actually 20% and not say 10% or 40%. And it also allows us to weight the sample appropriately. Often, depending on how we sample, households living in sort of urban versus rural areas or one district versus another might have a different probability of being sampled, or even households living in larger clusters versus smaller clusters. And so you don't want households you want every household to sort of have the same influence on your estimates. And so that's why we talk about weighting. So what we need for a probability sample is basically a sampling frame, which is a list of all of the households in the survey population. So this is not possible when we do surveys in large populations like a district or a region. So what people came up with many, many years ago is this idea of cluster sampling, where we divide up the area that we're interested in into clusters. that we can list out. So we develop a sampling frame of clusters, we select a cluster, and then we can enumerate all the households in that cluster, and that gives us the sampling frame of households in the cluster. So to talk a bit more about this, a cluster is just a unit that contains multiple sampling elements. So in the case of a household survey, the sampling element is a household. So a cluster is just a group of households. It could be a census enumeration area, which I'll talk about in a minute. It could be a village. It could be some other administrative area. Each household in the survey area must be included in one and only one cluster. Clusters should ideally be approximately similar in size. And cluster boundaries need to be clearly defined, right? So that allows us to know, whether a household is or is not inside of a cluster. In low and middle income country settings, when you're doing a household survey, we really recommend using census enumeration areas as clusters. So those are also known as EAs. When countries do their decennial censuses, they essentially carve up the country into these enumeration areas that have, on the order of maybe between 100 and 250 households each. So they're small enough that they can be, it is possible to enumerate all of the households in those clusters, and they are of approximately similar size relative to villages, which can vary really widely in size. And the EAs also have very clear boundaries. The National Institute of Statistics, or whatever organization conducts the census in each country, maintains a list of all of the EAs in the country, along with maps of each EA and estimated population size from the most recent census. And if you're planning on using EAs, you will want to get these lists from the National Institute of Statistics, and you'll want to contact them a little bit in advance to arrange to use these lists and the maps. Or sometimes they will offer to do the sampling for you in some cases. Again, you can use other types of clusters. You could use villages or whatever other cluster makes sense to you, but we have found that it is easiest to use EAs for some of the reasons that I mentioned. So just to talk briefly about the process for sampling clusters, we want to list the clusters in each stratum. So the strata are just the different areas in which you want to sample. So if you're working in two districts, for example, each district might be a stratum. If you want to have separate estimates in rural versus urban areas, you might have your urban and your rural areas might be separate strata. So within each area, essentially where you want to produce estimates, you want to list out the clusters and then sample clusters in each stratum using systematic random sampling with or without what we call probability proportional to population size, or PPS. So PPS essentially gives you a what's called a self-weighted sample. So what that means is that all households within the stratum will have about the same probability of selection. Not exactly the same probability of selection, because you're using sort of estimated population size from the census, which isn't going to be 100% accurate. But essentially what it means is that larger clusters with more households have a higher probability of being sampled, but then each individual household in those clusters will in those larger clusters will have a lower probability relative to households in a smaller cluster. So I'm not going to go through the formula, but basically know that if you use PPS within a stratum, everybody will have about the same probability of selection. This is good because it's analytically simpler to calculate the weights. And also you will have fewer different weights. And so you're basically, when you have a wide range of weights, it will inflate your variance without getting into too many details. So without such a wide range of weights, the variance will be smaller and you will have some more certainty. So how do we go about doing the sampling of clusters? You want to first order your cluster by geographical area, essentially by administrative sort of subunits. So if we were working in Burkina Faso, we would sort our list of clusters by region, then province, then department, then commune, then village, because those are the administrative levels in Burkina. It's going to vary by country. This is assuming that our stratum, of course, is the region. And then we would generate a random starting point, calculate a sampling interval K, which is just the number of clusters in your stratum divided by the number of clusters that you want to select. This is calculated differently for probability proportional to size, so we'll talk about that later. And then you start at your random starting point and you select every kth cluster until you reach the total number of clusters that you need. Excel is useful with this process. So this is the normal process. Now I'm going to show you what it looks like for in our cluster sampling tool. So give me just a second to get that up here. So as I mentioned, we have an Excel-based cluster sampling tool, which is up on the website. And we are working on a sort of a desktop-based version of that, but it's not quite ready to share yet. And I have too many windows open, apologies. Where did this go? Here we go. Okay, so hopefully everybody can see this. So this is the Excel file or worksheet for cluster sampling. And there are 4 worksheets. Input, which is the one I'm on, printout rural, printout urban, and printout mix. And basically what you can do in here is you have 2 options. One is proportional sampling. So if you want if you want the number of clusters sampled within each stratum, urban, rural, mixed, to be sort of proportional to the total number of clusters in that stratum, that's the option you would use. The second option is sampling based on a specific number. So let's say you want to sample 30 clusters in the rural area because you want about 1,000 households there, and you want, you know, we'll say 50, you want 15 clusters in your urban area because you're okay with having lower precision there. That's what you would enter here. And then if you go down, there's an area to input some information. So these kind of blue or gray columns are just different administrative levels. So here I've put in this is information from Burkina Faso, the region and the province. I've left the other levels blank for now because I don't want to be too identifying here. I put in enumeration area codes. These came from the National Institute of Statistics. The type of area of residence, whether it's rural, urban, or mixed. So in these cases, these are rural. And then the number of households that were enumerated in that enumeration area in the last census. So again, this is all information that comes from the National Institute of Statistics. And I know there's lots of columns here, but all you really need for this to work are your enumeration area codes, your type of area of residence, and the number of households enumerated. We have the number of households enumerated here because this samples with probability proportional to population size. So once I have entered this information, I've only entered rural clusters, so I'm going to go back up here and change urban to 0. I can go to printout rural, and basically it will give me my 30 clusters that it has sampled, 30 enumeration areas that it has sampled. So these are the enumeration area codes. And then on the far right, you can see the cluster. It's assigned a cluster number from 1 to 30 to each of those. Without going into too many details on how this works, essentially with PPS, the sampling interval is calculated differently. It's calculated based on the number of households in the enumeration area rather than just the number of enumeration areas. So I'm not going to go into any more detail on this because we don't have a lot of time. So I'm going to stop here. And I see there are a number of comments. Okay, let me take a quick look at the chat box. Is there a place or resource where we could check whether a certain country has EAs in digital form that you know of? You would have to ask the National Institute of Statistics or whatever the statistics office is in each country. It goes by a slightly different name in every country. I don't believe that information is centralized anywhere. So you would have to ask them. I think countries are moving more towards having digital information on EAs, geo coordinates and things like that, but it's quite variable from country to country. Okay, so then there's a question, did you mention how your tool suggests how to come up with the optimum number of clusters considering intra-cluster correlation? This is a good question. It's not addressed in our tool. It is addressed in the course, the coverage survey course that we've developed that does go into how you consider how many households to sample per cluster. We usually don't recommend going above 30 or much above 30 because it does increase the ICC or the design effect in the cluster. But whether you go for 30 or 20 or 25 is sort of up to you and depends on your resources. But it's the bigger your cluster, essentially, the less it costs, but also the higher the design effect. So you have to balance those out. But there's not a firm kind of rule for that. Okay, I really want us to break into groups. So let me
there's one question, maybe.
Yes. Oh, sorry, I just saw it. In terms of the net effect on the results, is it true that the sampling procedure adopted is more important than the sample size? Really good question. I would say yes, within certain limitations, right? So you don't want, if you have a sample size of 100 households and you're trying to estimate anything, but let's say exclusive breastfeeding, it doesn't matter how good your sampling is, you're not going to get a very good estimate. But assuming you have like a reasonable sample size, yes, I would say that the way in which you sample is critically important. And it's actually when I am sent like a survey to look at, or we're considering using one in evaluation, the first two things I look at are the sampling design and the sample size. And usually, if the sample size isn't great, often we can live with it. But if non-probability sampling was done, often there's nothing, we can't use the survey at all, even if the sample size was adequate. So yes, my answer to that would be yes. So that's a good segue into this very last point that I wanted to get into. Okay, so household sampling, we've talked a little bit about, well, we haven't talked much about how to sample households, but essentially we do have a similar tool for sampling households that depends on you having a listing of all the households in your cluster. So this assumes that you are you're either using high quality existing lists or you are mapping and enumerating the households in your cluster, and there are tools for that on the Radar webpage that for how to do mapping. It's also covered in the online course. And this will also hopefully be available as a desktop application. But I also wanted to mention, we've heard from many partners that mapping and enumerating households and doing this type of sampling is really difficult to do. It requires a lot of sort of technical know-how, and it takes time, and it's not free. It's not inexpensive. And so we've been trying to think about, is there a way to make this lighter? And one thing we've come back to is, can we use technology to make this a bit easier? Now we have GIS, we have really good aerial images of much of the world. And there are a handful of studies that have tried various versions of sort of GIS-based probability sampling. They've primarily been in urban areas. And so we wanted to try out that approach more broadly, like with a standard household survey that covers a range of different types of areas, and also to compare it head-to-head with standard sampling, as well as EPI or random walk sampling, which a lot of organizations use. And so we have implemented this study in Burkina Faso in urban, peri-urban, and rural areas, where essentially, I'm just going to skip to here. We had three arms. So we sampled 150 clusters, and within each cluster, we sampled households using sort of the gold standard approach of mapping and enumerating households, using a GIS-based approach where we use satellite images and sampled potentially residential dwellings from those images, and then the EPI approach where there's no sampling frame and you just go you sample households using a random walk method. There was also the census was happening at about the same time, and so we will also have census data in these clusters to compare to. So I don't have time to say a lot about this, just to say that the data collection, fortunately, was done right before COVID happened. We are almost done with the data cleaning and going to start analyzing the data. And so we hope that this will give us an idea of sort of the feasibility and costs of the GIS methods compared to these other two methods, as well as sort of the comparability of the estimates that we get using these different approaches. So stay tuned for that. And I'm going to stop talking now and let's check the chat and see if there's any questions there. I don't see any. So perhaps we can go to the breakout rooms, because I want to make sure we have enough time for that. Does that work for everybody?
Yeah, sure, yeah.
Great. All right, everybody. Many of you know the drill, so just hang tight and you'll be moved momentarily into one of 3 breakout rooms. Just so I'm clear, Melinda, for how long would you like to be in these groups approximately?
I think we'd like to maybe 20 minutes. I think if we can come back between like at 1:54, 1:53, I'm trying to get us as much time as I can in those groups.
Yeah.
Does that work?
I agree. Yeah, the 20 minutes is fine. And for people who already have a time to already work on compiling the different input, I mean that it should be faster. But now for people who didn't started yet the exercise, I will just suggest to focus on one indicator to try to have something so that can be used for discussions. So select the indicators, compile the input for the calculation, and then use now the sample size calculator also to now calculate the sample size and also see if the sample size needed for your study meet the requirement for power or for precision. So, and also if you needed to revise the input, and then we can come back. Yeah, so 20 is good.
And I think we lost people as soon as we said sample size, or as soon as we said breakout room. So we may only need 2 groups.
Yeah.
Okay, then just give me one quick second. I'm going to make 2 rooms and I'll move you guys over in a minute.
Great, thanks.
Thank you.
Thanks, everybody. I hope that went well. I think in our group, we got some good feedback about some of the some places where the tool could be clear, particularly around some of the parameters and explaining what we mean when by some of the parameters that we're asking for people to input. So let me ask the other group. I think there were only 2 groups. Sort of how did this go for you all, and were there any questions or suggestions for improvement?
Yeah, I mean that in our group also we have a Q run. Maybe some things we didn't talk about. When you go through the tool, there are some help. Okay. Yeah. So and once you click on there are some pop up. Maybe I can share quickly. For instance, oh, I don't know which one I'm sharing. Okay.
Yeah, I can see it's skilled attendant at birth.
Yeah.
The results.
Yeah. When you click, you are able to get some information. So, okay, there are some help saying that okay, this is what is mean, and where you are able to get some time of a different data. Okay, for example, parameters. Also, you are also able to see where you are able to get those different information and so and so. But I mean that maybe you can also have more help in the tool, and also to guide people when we want to use it. That is a great point. A good. In our group also it was fine. We have a discussion, and when some things are very interesting is to know how to decide on the correct or a more realistic endline proportions. Okay. You have your baseline, and also you want to see now what will be after 4 or 5 years. The change or you expect based on the interventions. And we say that there is a natural change, okay, without any interventions. And we are able to try the idea of this natural change based on maybe assessment of what happens for these indicators during maybe the last 10 years to see what is the increase. This is something that is also sometimes include even in the sample size calculations to see that. And also, we also have to see maybe based on similar experience in other setting, what have been maybe the proportions of the end up at the end of the day. That can also be something that's very interesting. And people sometimes are very ambitious in terms of target. Okay, we should be realistic and see what is feasible based on the available resources. But the problem sometimes when the impact of intervention is small, that means that we also need a big sample size to be able to detect the change. Otherwise, we are going to do our analyses because of the sample size is small. We are going to say, okay, there is no impact. It's not because there is no impact, but it's because maybe the change is just about 2-3%, but your sample size may be allow to detect a minimum difference of 10%. So sometimes this is the tricky part. This is something we discussed. It was interesting, but time was short, and we said that we can follow up or even with a side discussion. Over.
Yeah, really good point, Maiga. That if you want to detect a difference, you may want to be conservative about your end line estimates because you may not be able to detect anything less than that. Yeah. Okay, so I see that we are actually at time or beyond time, so I don't want to keep people, but I do want to thank everybody. I hope this was helpful for you all. It was great to hear all of your questions and also to get your input on the tool. So we hope that it's helpful, and as you use it and other tools, please do let us know if you have any other questions or comments or suggestions. And with that, I will hand it over to Jessica.
Thank you so much, Melinda. Not much more to say, but thank you everyone who has been here for this session and our previous sessions. I really hope that you found it a useful and helpful introduction to the coverage tools. I don't think this conversation or these trainings end here, but we'll certainly be feeding back any feedback that you give to on the tools to our friends at JHU and be thinking about how we can continue to bring some additional support or training to folks who want to think about how to use these tools within their own work going forward. So up here on the screen is Melinda and Talatha's contact information and mine as well. If you have specific questions about what we've talked about today or other things you want to discuss, please reach out to us and we'll be sure to connect you with the right information. As I mentioned at the beginning, we will be sending around a short survey. Please take a minute to complete it and let us know what else you'd like to see being made available. Just a note again that now that all 4 sessions are completed, we'll begin the process of putting the recordings up. This may take us a couple of weeks, so please bear with us. But as soon as we have them available, you will get an email from me letting you know where you can find them and where you can go to share them with your colleagues. So on behalf of all of us at CanWaCH, a huge thank you to the folks at Johns Hopkins for making this possible, for Canadian organizations on this call, for working with us to think through this kind of creative virtual format and what this looks like. Thank you to all of you and to your organizations for taking the time to be a part of it. And we really look forward to our next steps working together. So until then, take very good care. Bye for now.